type of anesthesia do you use?
That's a case-by-case basis. We are actually one of the few trained surgical specialties that has the ability to do from local anesthesia all the way to general anesthesia. But we have to do consultation with the patient and then see what their needs are, anxiety, medical history, and then how complicated the surgical case is. So on the spectrum of anesthesia, you start with local anesthesia, which is your classic shots. The next level would be laughing gas, which is nitrous oxide. That one works fairly good for a lot of patients. You don't need an escort and typically wears off as soon as you shut off the nitrous oxide, but you still need local anesthesia for it. So the best way to think of it is it's a anti-anxiety agent. There are some situations too where we'll also write a prescription ahead of time for like a Valium or something similar to that you would take before you come in. And then with those patients, you still need to have a driver with that one. Next level would be a sedation, and then that's actually as a spectrum too, so you can go from light sedation all the way to general anesthesia. We could intubate, meaning put a tube down someone's throat, but we typically don't do that. We do what's called a TIVA, which is a total IV anesthesia technique, to where you get the same effect, but you don't have to have a tube down your throat. With those patients, that'd be indicated for someone that's got severe anxiety, harder cases, or the patient doesn't like seeing us. That one you'll hang out maybe 20 minutes or so, and then we go over the instructions with the patient's guardian because you won't remember anything from the surgery. But again, that's the point of having general anesthesia.